streets of Baltimore. And on the topic of the medical staff, we are joined by one of the members of that medical team from MedStar Health, Dr. Eric Almli, who is here to tell us about some of the medical aspects of this race. Doc, first and foremost, thanks for taking the time to join us.
Yeah, you bet.
It's a busy day for you and for all the folks at MedStar Health who tend to the runners. When you watch this day unfold, what is it you most want to keep an eye on in terms of the runner's health?
Well, first and foremost, it has to do with the temperature, right? We want to make sure that everyone's prepared for the weather. On a day like today, it's cool. As long as people are able to shed layers and make sure they have the right clothes on and take the right hydration during the race, then they're good to go. But if it's a hotter day, like this morning, I was a little nervous because it was kind of humid. When the rain evaporates off the road, it can make it a little more humid, and that can affect the temperature that the runners are feeling during the race.
We were talking about that. It's a little cool if you're spectating. You know, Jerry, you're trying to warm your hands up, but 60s is a little warm. We had projected it would be about 62 on race days, a tad warmer than you'd want, and you could feel the effects of that and come into one of your medical stations out along the course.
This is probably not the coldest year I've seen in the past, say, 5 years or so, but we will almost assuredly have a couple people that have heat stroke, and have the tools to take care of that.
So when you're running at a marathon, it's such a personal goal. People have trained sometimes 6-7 months to get to this point, and they want to push through the pain. Understandably, in sports, you want to be able to push through. But as a runner, what are some of the signs a runner should think about that it's time to stop pushing through and pull off to the side of the course?
I mean, that's every individual runner has their own sort of way of dealing with that, and I think that if your body's telling you that that you need to slow down, you need to slow down. If you're getting overheated and the temperature's not right for you, then you need to just pull over and take a break. Yeah, I mean, it depends on each individual runner when they make that decision. And, if you're starting to get nauseated or if you feel like you're going to pass out or anything like that, we hope that they pull over at one of our first aid stations that we have along the course, take a break.
I remember I was finishing one marathon, and at the end it was, it's all the bike racks up and it's all wrapped up, and I just needed to vomit. I said, where can I, hey, listen, anyone out there who's
Kate,
run,
some people haven't had their
one of these
yet.
knows what I'm talking about, but it's a legit problem. Some people are used to it as part of a run, but for others,
and there's a very easy solution to it. Don't run a marathon.
Yeah.
Jerry, we're trying to get people into it.
That's right.
I'm sorry. But I was saying, for some people, they're used to it. Some people, it's a sign of that they're heading for some danger.
Yeah, it can be. Yeah, and then you'll know it when you're training. If you're training and you're preparing for a marathon and you don't have that problem when you're training, then you know that if you are getting that ill by the end, that maybe something's not right, right?